Hi, Kristy Harris here for video 3 of the Skin Games. Kristy from Shapiro Plastic Surgery. So I actually did not earlier record a video or do a treatment for week 3, and I wanted to explain why we didn't do that for a couple of reasons. One, I did on week 2 a Obagi standard blue peel on my client, and that makes you peel for about a week. And so what that means is by week 3, my client would not have been ready to have any type of other treatment. It just simply wouldn't be appropriate to do anything at that time. The other reason is it fell on Thanksgiving weekend. So that's something that those of us in the aesthetic industry typically have to deal with, is working around holidays and work schedules and social calendars and that kind of thing. So I think it's kind of good to talk about that for a minute, just because it's a fair representation of what we do in this industry. Anybody in the beauty industry can totally relate to dealing with our clients and their social calendars and everything that's going on and how long it takes for them to recover. So that's why we didn't do a treatment for week 3 or a video. So I thought instead I would just take a minute to better explain my treatment protocol and what we're trying to achieve with my model in this treatment. So my model has a darker skin type. She's mixed ethnicity, and we're treating hyperpigmentation. I work in a medical aesthetic practice. I work for a plastic surgeon. I am an esthetician, and I'm also a certified laser technician. So I've been doing this for almost 16 years, coming up on 16 years in January, actually. So I am actually going to be doing a photo facial on week 4 for my client for some of her pigmentation. The reason I started with a peel is because she has darker skin type. And so I would not have wanted to do a photo facial on somebody with her skin type without either preconditioning or doing something to kind of lighten up her pigment prior to, or she'd be high risk for burn. And because we're doing the contest and I had an 8-week time frame to work within, I had to sort of modify things a little bit, which is fine. Sometimes I have to do that anyway. If I have a bride come in and I only have 3 months to work on her, I can't always take the time to do things the way that I want to. So I think that it's fine that we did that. So the first week, on week 1, I opted to do a microdermabrasion and dermaplaning along with the innovative facial. It's also sometimes called the red carpet facial or the fire and ice facial. It's something that is by Innovative Skincare. So I used their treatment masks and kind of prepped her skin. And then for week 2, I chose week 2 to do the peel also because my client had the time off from work and could afford to peel. Week 3, we chose not to do anything because it wasn't appropriate. And now week 4, we're going to do a photo facial to target some of the freckles and brown spots that are there. And then for weeks 5, 6, 7, 8, going into the future, we're just going to do not a lot of aggressive treatments, things that are a little more superficial, maybe some exfoliating treatments and hydrating treatments and things like that. And she's going to continue to use her Obagi skincare. And that's really important when treating dark skin types because everybody is at risk for hyperpigmentation with any procedure that causes inflammation. So that could be a chemical peel, laser, whatever. But when we start treating darker skin types, that risk is increased. So having my clients use, hydroquinone, tretinoin regimen to precondition reduces their risk of hyperpigmentation, and that's also how we would correct it should they hyperpigment. And hyperpigmentation does not necessarily mean something went wrong with the treatment. It's just how the skin can respond to inflammation. So you always want to prepare your patients to expect that and let them know that that is a risk with treatment and how you would correct it. And with treating darker skin types, that's even more critical. And I intentionally wanted to find a model with a darker skin type because it's a little more challenging to treat. And I feel like there's a place to treat people with dark skin and that everybody should have a place to go. And I really enjoy having something a little more challenging. So I was intentionally looking for a model that would have a darker skin type so that I could show that we can actually treat people with dark skin. And that is what we're doing. So stay tuned to see what we're going to do in the future.